You're watching the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. According to my first guest, he says no more dentures. And for those people that are headed toward dentures with broken down teeth and other problems, he says that there's hope, that you can literally walk into his office the day of the procedure without teeth and walk out with a fixed set of teeth that don't come in and don't come out. Dr. Hiers, welcome to the program.
Oh, thank you for having me. It's a pleasure to be here.
All right,
so
now,
excited.
Now, I know you brought some photos and some models, and we'll get to those. But for people that don't know your practice, I guess you have two busy practices.
Yes.
Who's the typical patient, and what are the different services you offer?
I guess we really don't have a typical patient. We see children as young as 3, and there is no limit to the upper end of the age. We see people in their 90s. So my focus in the practice is dental implants and sedation. Those are things that I found were most beneficial to some of the patients that have some of the more complex problems.
So today's topic, dental implants. You have been, I guess, studying, we've talked on the phone, dental implants, I guess, since the early 90s.
Yes. And, you know, I sought out people that where I could be trained, and I went to Mish, who at the time was writing contemporary implant book, his first book. And I sought out, he had an institute, and then I actually went through the institute twice. I then sought other practitioners, varying views.
All about dental implants.
All about dental implants. I went to a person named Michael Picos in Florida. There was countless continuing education.
Is there that much to learn? I mean, because you even told me that you went to Budapest last month to learn about new dental implant techniques to replace missing teeth.
Yes, you know what's happened? There's been such an evolution in the whole implant industry. We've got to the point where we can grow bone, and there was a particular technique that I needed for several patients. Actually, patients that have teeth are more difficult than patients that don't have teeth. And so I needed a particular technique to help several of my patients. So I had heard about this gentleman, Istvan Urban, and I went to Budapest to hear him speak and learn about what he was doing, because he's doing something that's way less invasive than a lot of the things that I've actually learned in the past.
Now, we've talked on the phone. I guess the way you're doing it at your center is different than how implants are normally done. I guess you go to one person that is like the surgeon.
Right.
You go somewhere else that puts the tooth on top, and then maybe somewhere else for the imaging. You do it all right there.
Yes,
Elaborate
that is the way it's normally done. However, in our office, we do it all under the same roof, and actually I do it all. I kind of felt responsible for the whole process, for placing the implants, for doing the fixed teeth. And
it really is done like in 3 different places sometimes?
Yeah, absolutely. In fact, traditionally, that's the way it has been done.
So in your practice, I guess you also have 2 other dentists that work there, but your focus is the dental implants.
Absolutely.
And you love it. Why is it you like it so much?
Because I love being able to help people. I've watched so many transformations from people that were withdrawn socially in many different ways to just total changes in character. Watching them come in and now they can go into the public, they can eat and chew and smile and have fun again. They're reconnected with friends and family. It's miraculous to see.
Happiest group of patients?
Oh my goodness.
I mean, better than the cosmetic dentistry stuff? And
you know, in a lot of ways, because the cosmetic dentistry stuff, it's wonderful in what it is, but this is really total transformation. I can give you an example of somebody, Randy.
All right.
This just happened about 3 weeks ago. I was in the office, and I was walking down the hall, and I just glanced in one of the treatment rooms. There was this beautiful woman, and I walked down the hall, and I got to the end of the hall, and I said, "Well, who's that in the room?" And he said, "Well, that's your 520 post-op." I said, "My post-op?" I said, "I don't even know who that woman is." And he said, "Yes, you do. Go in there and take care of her." I said, "Okay." So I walked back up the hall, and I peeked around the corner and looked in the room. And oh my goodness, this woman.
So it's a past patient?
It was the patient I just finished like 2 weeks ago. And she smiled, and her smile lit up the room. But the thing that her hair was done. She had makeup on and jewelry on and these beautiful smile and a beautiful dress. Now, this is a woman that had come to me. She had sweatpants on. When I first saw this woman, she came in, she was holding her top teeth in with her tongue because she couldn't even keep it in with denture adhesive. Now she had a full set of teeth, a lower set of teeth that were absolutely, completely stable because of implants. She was the happiest thing on earth.
So it's good for the self-esteem.
Oh,
obviously.
My goodness, unbelievable change.
Now, we're talking about dentures, because at the top of the show we said no more dentures.
Yeah.
And you don't think that anybody should be wearing dentures?
Not at this day and time. No, we can give you a full set of teeth that are fixed. They stay in place. They can come in and out if you wish, and sometimes that's better depending on
like a snap-in, snap-out?
A snap-in, snap-out denture, and that's dependent on the patient's ability. I've actually had dentures of some of the elderly people. We had to practice a little bit because they snapped in and they stayed in a little too well, so we had to practice.
They couldn't pull them out?
Yeah, they couldn't pull them out. So I said, well, I'm sorry, that's a permanent set of teeth now, so I'm going to have to charge a little more. So then they struggle a little more, and they get them out, and so they're all excited after that. But we have a little practice sessions to make sure they can get them in and get them out.
So you think that's a future where because I guess dentures aren't attached to anything, right? Except
absolutely,
for the adhesive. So the future, everything will be attached to something.
Absolutely.
Is that what you think?
And that is the problem with dentures, is they aren't attached to anything. So they're moving all over the place, and people aren't able to function well with them. But so often in this day and time, they don't know any better because they got these dentures 10, 20, 30 years ago. They're so used to not being able to chew anything, they don't know any better. They don't know there's an alternative.
So where you are there a lot of people with dentures?
Oh, absolutely. There's probably tens of thousands that either have dentures or replace missing teeth, or they're about to lose their teeth. They've been told they're going to lose their teeth. They have issues that were going to cause them.
And they're headed to a denture.
They're headed to a denture, absolutely.
And nobody wants a denture, obviously.
No, they don't want a denture. And years ago, that was the only, when I came out of school, there wasn't an alternative. They weren't doing implants. I mean, I know that was the prehistoric time, but but it's changed. Everything's changed. Technology's changed everything.
If taking a denture and then locking in, giving them a fixed set of teeth that don't come in or out, I mean, if it's so good, why aren't all the denture wearers, you said there's tens of thousands, why aren't they all doing this? What's your take?
At this point, I believe these are people that just don't visit the dentist anymore. They don't think they have any reason to come to the dentist. So they don't know about advances in technology. They don't know that there's an alternative to what they received 10, 20, 30 years ago at this point. So they didn't come. All right, so the second reason I see is they remember what it was like before they got the dentures. They remembered multiple trips to the dentist. They remember the failed root canals. They remember crown and bridge that broke. They remember they had these splaying teeth. They had gums that hurt. They had all these different issues, patches. They came back and forth. They were in pain. They were, financially they were hurt because they were doing things over 100 times. And finally, they said, I've had enough. And they got rid of their teeth. And they got these new dentures. And they were like, oh my goodness, these are impossible. But I don't have any choice. I have to get used to these things. So they adapted.
So they don't want to come to see you. That's the second reason. They're afraid of you. Do you ever hear that? Like, no offense, doctor, but I don't like the dentist?
I hear it every week, Randy.
You do? They say it to you?
Yeah. I say, well, sometimes I say, I don't like you much either, but it's okay.
Okay.
These are things that we deal with. Sometimes I think that's why dentists have such a high suicide rate, that they take it personally.
Okay.
It's not personal. I understand exactly what they're talking about. I don't know anybody that gets, although I do have some people that are excited to come see us, but for the most part, it's not their favorite thing. So then they get into cost. They worry about the cost, and they've been told, or they think that they have an implant for every missing tooth, and they take their denture and they look at their denture and they say, oh my goodness, I've got 14 teeth down here and 14 teeth up that, and if I multiply that, oh my goodness, that's a big number. So how am I going to afford it? But that's just not the way it is.
And for people just tuning in, my question to you was, if dental implants are so good to lock in a set of teeth, why aren't they all doing it? So you're saying is because they they overestimate how much it's going to cost.
Absolutely. It's very, very affordable. It can be broken down into all kinds of different ways. So Randy, this is what I'm telling you. With 4 or 6 implants, I can give them a full arch of teeth that don't come out. They stay in all the time. Those are the types of things that we've evolved to at this point.
Now, if you're wearing a denture for let's say 30 years, I mean, isn't it true though that you can't do this? You don't have enough bone.
No.
For dental implants.
You know that, and sometimes oftentimes we have people that come in and say that, and I say, well, I understand, and indeed you have a little bit of bone, but the practitioner that you probably saw, he may not have the training or education.
Because they're told by other dentists that
they're told by other dentists that this might be the case. They may not have the training or education, and they may not have the imaging that would show the 3-dimensional image of the bone. So maybe for that practitioner, that is a situation, but it's very, very rare that I've seen patients that we couldn't help.
How old can you be to get this done?
I don't think there's any limit on the age. I've put implants in a 94-year-old before.
Why would a 94-year-old want to do this?
Very simple. Quality of life. Absolutely. They are no different than anybody else. Socially, they're extremely socially active, and most of the older people, it seems like their whole social lives revolve around eating.
That's a good point, right?
I mean,
everybody's bringing them food.
Yeah, they're bringing them food. And, it's very embarrassing for them not to be able to eat that food. I mean, they want to be able to laugh out loud. They want to be able to go out socially. And a lot of them, Randy, have lost mates. And they want to date again. And they're like, well, I don't really feel comfortable because I'm worried I go out.
So they're self-conscious with their denture?
Absolutely.
They tell you this on the consult?
Yeah, they go out to restaurants and they say, well, I have to look at the menu and I have to go down and, oh, I can eat that because I know I've done that before. So they're withdrawn to some degree socially. And so they're challenged and they hide it. They want to hide it, the fact that they're wearing dentures. But if you've got a fixed set of teeth and you can eat anything you want, it doesn't make any difference. They don't have to do that.
So even if in your 80s, right, you give them a fixed set of teeth that don't come in and out,
right,
they can eat like a broccoli or like a carrot or an apple?
They can eat anything.
They can bite into it with their front teeth?
They can bite into it with their front teeth. They can eat ribs. They can eat chicken. They can eat corn on the cob.
Do they ever tell you eating stories?
Oh, yeah.
All done?
Yeah, I love it. Sometimes they'll call and say, well, and they'll say, are you sure I can eat an apple? You sure this won't come out? No.
It seems a little scary.
Yeah, I mean, they haven't done it for so long, and so you have to encourage them to do it. It's amazing. It's like, okay, do we need to practice this? No. But they do. They can eat anything they want. And we don't have any restrictions. So, I say that I'm not real fan of hard candy, but most anything else, we're good.
What about pain? It does seem painful, to get an implant in there.
It's interesting. Actually, we sedate people most of the time, and they're not feeling anything. I'm not feeling anything.
No pain for you.
No pain for me, because when you're sedated, it's easier for everybody. Everybody's relaxed. We have a very comfortable situation. They're being monitored. We have extra people in the room, and we're able to just move right through the procedure. And interestingly enough, in the bone, which is where your implant is going to sit, there aren't nerves. Tissues is where the pain comes from, and we're very careful.
So the gums is where
the gums, yeah, the gums. And typically, we give them pain medication that they don't use. Typically, all they do is take something.
So after it's done, we're talking about after
it's done, they typically take ibuprofen, and that's all they need. Even though we give them, and they bring me back the prescription. She said, well, I had this. I said, well, you can just tear the prescription up, or you can throw it away to be fine. And so we actually give them prescriptions ahead of time just to allay their fears, but it's rarely used. Rarely.
So pain should not keep you from doing this.
Absolutely not. Absolutely not a problem. So at the end of most of the procedures we get done, and 70% of the time they've been out most of the time, or sedated to the point where they're not certainly going to remember anything, and they get up and they say, "Well, are you finished? Are you done?" And I, yeah. Well, I don't remember you doing this or that. Well, that was the idea. You weren't supposed to remember. That's what. So, and oftentimes, and then the next thing is we will hand them a mirror, and I can give you stories about the reactions are just.
So they went from not having any teeth or really an ugly looking denture. So you give them a mirror.
Yeah.
And what happens?
Well, it is. There are so many stories along those lines, but especially at the end, we may give them a mirror if I think they're sedated. The sedation's short enough, or they're back with us enough, and I'll give them a mirror, and they look, and then they cover their mouth, and I'm like, oh my gosh, what, they don't like what we did or what? And then I recently had this one woman, and I'm looking at her, and the tears welled up in her eyes, and she does this, and I'm like, uh-oh, what? She says, give me a hug.
Is that right?
Yeah, so I came over and gave her a hug, and then I had to get out of the room because I was about to start crying. I was like, oh, this is wonderful. This is transformation in this lady. So that's a typical reaction of people, and certainly that's even more often when they come back like a week or 2 weeks later, and I ask them, what did you remember? Well, I remember getting in the car. Well, that's fine. That's okay. That's good.
Okay. So they just need a ride home.
Yeah. Yeah, they have to have
How soon can they eat after this is done?
Actually, they can eat after the sedation wears off. They can eat.
They can eat that night if
they can absolutely eat that night.
Is that right?
Absolutely.
So no more dentures. You brought some photos. What are we looking at here?
I brought this one.
Okay.
This is Miss Grace, and she came to us, and she could not keep her lower denture in. She was using all the adhesive in the world. Her dentures really looked way too big. She has a really, really small mouth, and she said, I'm 88 years old. I still have a lot of living to do, and can you help me? Can you help me? And I looked at Miss Grace, and I said, well, Miss Grace, you don't have much bone on the bottom, but we can still get some implants in there. And how you doing on top? Well, she said my top denture's pretty stable, but I'm not sure it looks right. I said, well, I think we can help you. I think we can cosmetically fix that, and we can give you some implants on the bottom, and we can lock that denture down and make it so that you can eat or chew or do anything you want with it. So as I'm talking to Miss Grace, I'm thinking, wow, this is exactly the kind of patient that she just fits right into everything we're trying to do. We can change everything about what's happening in her oral health, and we can give her back the ability to chew. We can. She is the prototypical patient from years past that had been lost in the system.
So they really can't eat very well. Like a woman like this was like eating.
Right. You have a very selected diet. You're full of carbohydrates because you can't get the fiber. You can't chew the salad. You can't do carrots, all the different things you want to be able to do. So what I did for her, and I'm thinking this while we're doing the consult, I'm thinking, oh my goodness, this is going to be the perfect ending. And we put the implants in. We gave her teeth that she can snap in, snap out, and she can eat and smile. She can do anything she wants, everything she wants.
Like how many implants to get a full arch of teeth in her case?
4.
Okay.
In her case, 4 was the perfect number for her, works for her. She's able to do anything she wants.
It's a pretty smile.
Oh yeah, one of the things we did along as we to get things just like we want, we had multiple try-ins with her upper teeth. I said, Miss Grace, we want these to look just right. And I said, I want you to approve these teeth. So we had some try-ins. I said, what about these? Well, I need those teeth a little bit bigger. I said, that's fine. We'll change those out, and we changed them out. And she said, I like these corners rounded a little bit more. I said, that's right. That's a feminine look, and that's the kind of look we want. So we got them just like she wanted before we finished them. And that's typical. And we actually asked people for pictures of in their youth when they had a full smile, if they like what they had, and we try to match those teeth.
So they could look real. Because
So
I
they
feel like
look
I could spot
absolutely-
dentures walking down the street.
Yeah. Yeah, we want them to look absolutely 100% natural.
Now, we are short on time, and I know you brought me models. So what are the options for denture wearers? They come in, or maybe people that need a complete, extractions. What are their options as far as dental implants?
Well, probably the simplest option, and the first option is just 2 implants. This is the lower arch, and the dentures just snap in and snap out.
So is this exactly the way it is? I mean, this is
Yeah, just like
okay,
that.
snaps in.
And snaps out.
Pretty firm.
Yeah.
Is it hard for them with their hands to pull these out?
Yeah, but that's why we have practice sometimes. We have to practice.
Okay.
So I actually had a gentleman. He'd been coming to the practice for years. He had his own natural teeth on the upper. And he'd been in the practice. Every time he came for his maintenance visit, he was complaining about his lower denture. After about 5 years, I'd had enough. I'm done. I said, Robert, I've heard you complain for all these years. So anyway, I'd had enough, and I said, how would you like to have a lower denture that just stays in place? He said, well, yeah, I'd like that. He said, but I don't think I don't want to afford it, and I don't want to pay for it. I said, but you really like it, right? So I'm going to give you 3 implants that are going to lock your denture in. Yeah, we're going to use your own denture. And if you don't like it, you don't have to pay for it. He's like, are you kidding? I said, no, really. I said, I'm tired of hearing you complain. We did the 3 implants. We attached them to the denture. I said, I'll see you in a week. I said, come back for a week check. He came back in a week. I walked in the room. He looked at me. He said, why didn't you make me do this 15 years ago? I said, I guess you just weren't ready. He is one happy camper. Because again,
he ended up paying you.
He absolutely paid me.
Is that right?
Yeah.
Well, why didn't you make him do it? Because you deal with a lot of denture patients.
I do all the time.
Is it because you feel pushy telling them, hey, you should do this?
Yeah, and you do. And you don't want to feel that way. You want people to want your service.
Yeah, I can appreciate that.
You really do. You want them to want the service, but they just don't understand the benefits of it until they experience. I guarantee you that if anybody could experience having 2 or 3 or 4 implants for even a weekend, they would never go back. They would never go back. They'd have an arch of teeth that stayed in place, function, do anything they want. It would be such a transformation.
So these denture wearers that are watching this, and they think they're fine.
Absolutely.
You're saying that they don't know how good it could be.
They have no idea how good it
Because I
can
know a couple of denture wearers. They never complain. They seem to be fine.
But Randy, they would never complain to you. They come to me.
Okay.
Okay?
It's
Look,
fair.
I had a lady, and this has happened several times in my career, but this is one that comes to mind. She brings a brown bag, and I'm like, she's sitting in the chair, and I'm looking like, what's this brown bag? I said, all right. I said, Beth, what can I do for you? She said, I'm having so much trouble with my dentures. She said, well, can I show you? I said, sure, you can show me. So she picks the brown bags up and she dumps it on my tray, the whole bag. There's 4 complete sets of dentures in there. And she says, look, this top set here, oh, they look so nice, but I can't eat with them. I just can't eat with them. And this lower set, but this goes with this over here. And I can chew with this, but it doesn't work real good, but it's better than the ones that go with this set. So she's giving me all these sets and how they could go together if I could just get it right. And I'm like, I don't think that's going to work. I said, but what we can do, we can give you a fixed set on the lower, and we can give you a fixed set on top. And when we're done, you will be one happy camper. And sure enough, we went through the whole process.
So you gave her, with dental implants,
Dental implants.
teeth that don't come in out on the bottom or the top.
Right.
But isn't that what everybody wants? I mean, they don't want teeth that come in and out anymore.
That's what they want, Randy, absolutely. They want teeth that don't come in and out. They want their natural teeth back. I mean,
You call it a third set of teeth.
a third set of teeth. It's just like original equipment. Doesn't get any better than that.
And they're permanent. I mean, they can last as long as you last.
Absolutely. In fact, in a lot of ways, they're more stable than natural teeth. They don't decay anymore because they're made out of titanium. They're repairable. I can take them, once I take them out, I can take them to the lab and fix them and put them back in. That's a whole lot easier. Especially some of the history, some of the experiences,
Okay.
some of the
I have to ask you this question because I wanted to ask you. But if you have bad gums, right? Your teeth are failing, or they're ready to fall out,
Right.
Or they've been told you have to have all your teeth taken out. Can they still do this? Are their gums good enough for dental implants?
Right. It actually, once the teeth are gone, basically the problem's also gone. And so it might take a little more time. We might have to do a few more things, but absolutely not a problem at all.
Okay, good. Well, final message, somebody watching this, and they're still skeptical, right? They go, I don't know, I'm too old. I was told I don't have enough bone. But they're wearing a denture they can't stand, or they've been told their teeth have to go and they're headed to the denture. What do you say?
Come on and talk. It doesn't cost a thing to come in and talk. Consults are absolutely free. I'd be happy to talk to you about it. I'd be happy to go over it with you, explain it, show it. That's what we're here for. We're here to help people.
Okay, good. I want to thank you for coming on the show. Very interesting.
Thank you.
Very nice.
Thank you.
You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.